All right.
Oh, it says.
Yep.
Okay.
In the Stillwater office that work with kids and adults with intellectual disabilities. And I brought 2 of my social workers with to help us do the presentation. And then we also asked some economic assistance eligibility workers to come and talk about medical assistance, because that's not really our expertise. So they are going to go first, but I am going to turn it over to, well, maybe we can introduce ourselves first. Maybe that would work. I'm just gonna point you out as I see you. Cindy, you're on my list.
Unmute there. I am Cindy Jankowski. I'm a senior eligibility specialist on the families team.
And then Jenny.
Gotta find the right unmute button. I'm Jennifer Trom. I am an economic support supervisor, and my team determines eligibility for cost-effective insurance.
And then Danielle.
I am Danielle. I am a senior eligibility specialist with the families unit.
And June.
Hi, I'm June. I'm a social worker. I work with individuals with intellectual and developmental disabilities.
And Jane. Oh, you're muted still. Can you unmute on the bottom? There you go.
Sorry. This is Jane Fellower. I'm an IDD intake worker and I'm in Choices reassessment worker.
And Chantel.
Hi, everybody. My name is Chantal. I'm a social worker with the Intellectual and Developmental Disabilities Unit as well. Nice seeing you all and being here tonight.
I'm going to turn it over to June. She's going to get us started.
Okay, thank you. Welcome, everybody. We are going to try and condense quite a bit of information for you tonight. We've divided the talk into 3 main sections. The first one will focus more on the general eligibility, where our eligibility specialists are going to help us with that, making sense of medical assistance and some of the other requirements. After that, we'll talk about the IDD specific eligibility issues and also case management and a few of the services that are available. But before we started, I wanted to point out that there are quite a few programs that are administered at the county. Some of those are paid for by the county, others are paid by different sources of funding. It can get confusing, so if you have questions, please feel free to reach out to us. We will give some more information on how you can get in touch with us. What we're going to cover is some of the basics, because when we each start going into detail, we kind of get lost into it because there's a lot of information. So we'll give you some of the main points to help you get started thinking and or applying if you're at that point. And by no means does this information cover everything that you need to know. And as Lisa already said, we have quite a few teams at the county where services are concerned. And when someone is trying to get started receiving services or navigating services, there are a couple of teams that you are likely to come across, depending on your needs and also what stage you are in. So whether you're trying to apply for a child or someone who is a youth, a young adult, it all depends on your assessed needs, and that is going to determine who you are likely to get started with or who you are likely to be in touch with. But tonight, we've tried to put together a group that comprises of the 3 main groups or teams at the county that you are likely to come across. The first one is the assessment that is used is called Main Choices Assessment. They do assessments to determine eligibility, criteria, and Jane is going to talk a little bit more about that later. The other team is the team of eligibility specialists who are going to determine the overall eligibility for programs, specifically medical assistance and others, and they will walk us through some of what they do. And then the case management team, which provides ongoing support, and we'll talk more about it in a little bit. So to get us started, I will turn it over to the eligibility specialist team. They're going to get us started with the medical assistance discussion. Take it away.
Hi. So medical assistance is Minnesota's MA program. It's Medicaid. It pays for a variety of services, doctor visits, prescriptions, hospital stays for low-income families, and people and adults over the age of 18. There is an medical assistance MA site for details that you can hit the hyperlink on if you want more information in the future. Income and assets are contingent on the type of coverage each person is requesting and the applicant's age. You can also have primary insurance or insurance through an employer. That does not disqualify for you from having medical assistance, but your primary insurance is billed first and MA picks up the secondary coverage. There may be a copay due for services, and not all services are covered, but there is an MA member line, and the phone number is 651-431-2670 for more information on this services that are covered.
Okay. All right. Can everybody hear me? My screen went away. So the second screen we're looking at is kind of diving into medical assistance, where medical assistance for those without a disability, those we want to encourage to apply online through the MNsure.org site. There is a paper application that can be completed, but we highly, highly encourage the online application. Medical assistance for those with a disability where they are not pursuing a waiver or they're not pursuing a TEFRA program, but they are disabled. It is still encouraged to apply through MNsure just to make sure that there's no standard eligibility. There's so many different moving parts when it comes to these programs. And so if you're ever not sure, you can always reach out to the county and we can always help you walk through what the next proper steps would be. If there's no standard eligibility through MNsure, then we look at what other programs we're looking at. Usually it's a certain populations application, and I provided the form number on these because this paperwork is available to the public online. However, each application can pertain to different programs. So it's also, again, encouraged that you give us a call, and so we can let you know which application is the best to pursue. A certified disability is a requirement for this application as well, either through the state medical review team or through Social Security Administration by receiving SSI or RSDI. The next program would be medical assistance with disability for waiver programs. If the applicant isn't already on medical assistance, the financial worker or the eligibility specialist will need the following documents to establish the waiver request. And this is a lot of internal workings that we can work with the social worker with as far as receiving these documents. The request for payment of long-term care services that's completed by the client or the client's parent. If the applicant isn't already on medical assistance and they're pursuing a waiver, and this would include the DD waiver, then there's a bit of a longer application that's required. And again, we are in communication with the social workers on this. When it's a waiver and it's not a DD waiver, a certified disability is still required for this type of application before we can do any types of approval. Again, that certified disability would be through SMRT. You'll hear it being called that. That's the state medical review team or the Social Security Administration. The exception being that the client is being placed on a DD waiver, and that is established by social services.
So in order to qualify for medical assistance for disability, and if a family's over the income for the standard medical assistance, you'd be applying for the TEFRA program. This is a medical assistance program for children with qualifying disabilities who live with their families and do not qualify for MA due to the income limits. Only the child's income and disabilities are used to determine the eligibility. There is a state parental fee for TEFRA that's based on the family's income and size. And there's if I receive an application for TEFRA, I automatically send out the MA website information and the kind of do-it-yourself sheet on how to figure out what the parental fee could be. The application that's needed for medical assistance TEFRA is the 3876, the certain populations application. Once I get that, I will make a referral to the state medical review team right away. The application will pend until there's a decision made from SMRT. SMRT in this time period then contacts a family to determine the applicant's needs and disability status. This process can take months. And so if they contact you, the best thing you can do is get the information that they're asking for back to them as quickly as possible. Otherwise, I mean, I've seen applications penned quite a long time because families didn't know they had to submit something or they were missing something. So the best thing that we can say is make sure that you're in contact with SMRT during this process as much as you're in contact with your social worker about this process. Medical assistance in general for processing for non-disability applications can take up to 45 days. If the application is incomplete at that 45-day mark, it is denied. And then if it's a disability application, we've got 60 days to process. If it remains incomplete at that point in time, it will also be denied. However, if we're waiting on a state medical review team decision, we let that sit because that's not something that we know that's going to take a little bit longer. SMRT and Social Security Administration timelines can be lengthy, so it's imperative that you guys are providing the requested information timely to them so that they can get the decision made about the disability status.
This is my piece, but I thought maybe we should give people an opportunity to ask questions just about applying, because the next piece is once you're already determined eligible for medical assistance, then we can look at cost-effective insurance. So does anybody have questions now about applying for medical assistance?
I have a question. Or do you want me to type the question?
You can ask. There's no other questions in chat right now.
Yeah. you
Okay,
can-
sorry. I'm sorry. I'll do it in chat next time.
No, that's fine.
We can have a conversation.
I just wanted to make sure I was reading that slide correctly with Cindy. I always thought the MA was required in order to be approved for a waiver, but that slide made it seem like that I had that wrong.
So it kind of all has to happen at the same time. The waiver, as far as I understand, as far as establishing it like a non-BD waiver, would be that there has to be the application in process. But the MA has to be approved before the waiver services can truly begin. The waiver can be, as far as I understand from the social services side, is that, hey, yes, waiver services, let's do this, let's start this process. But those waiver services are not going to start until MA is approved, and MA can't be approved until there's a certified disability that's in place if there's not one already. Does that help answer the question?
Yeah, thank you.
Yes. Okay.
There is a request to go back to the non-waiver versus waiver slide. Lauren, is this the slide that you had a question about?
Yeah, I'll chime in. Actually, this slide right here. The reason
Okay.
I'm asking is, well, I'll introduce myself quickly. I'm Lauren Kaplan. I work with the Down Syndrome Association of Minnesota. I'm a family connector, and I help families walk through this process a lot for who are in the Down syndrome community. And there's often confusion about how to apply for MA. They don't know, families don't know what category they sit into. One of the big things though, and I guess my question is, so this is in reference to 18 and above. Is that correct? On how
So
to apply for MA.
I don't think so.
It'd be for anybody. You know, when you're applying, even if it's a person that's under the age of 18, you can apply through MNsure. Children, there's children under the age of 18 that can be a waiver. Consumer support grant. So I'm assuming that these children or these clients, they are not certified disabled then, or are they?
Sometimes not. My question really is that families don't always know whether they are wanting a waiver or not, or if they'll be eligible. So how do they know what way to apply for MA based on this information? Because it's given, there's two options at this point, a non-waiver, this is the route you go, and a waiver options. But families at the very beginning don't even know which,
Right.
what they're looking for.
Mhm.
So I would just say that if somebody's just applying and they haven't been approved for the waiver, like if they're open with a social worker and we're saying, yes, we approve you for the waiver, but you have to get on MA first, then we could just do the application. They don't have to be, if they're intellectually disabled and open with our social workers, they don't have to be certified disabled. Because we made them eligible and did all the tests, we get all the testing, we can say they're eligible as a disabled child or adult. So if they don't know that they're going to be on the waiver, they just need MA, then they would have to fill out, they would have to be certified disabled through SMRT or Social Security, and they would have to do the MA application. Because we're not saying they're going to be on a waiver like right when they start MA.
So applying for MA through MNsure first, and either they're approved or not. If they were not, they would be looking at MA TEFRA. If it's a child.
If somebody's already certified as disabled, so if you're talking about an adult who is getting Social Security benefits and they're already considered disabled, then you don't want to apply through MNsure, because MNsure would be for adults who are not disabled. If they are already considered to be disabled, you're going to want to fill out a certain populations application. That's a paper application also that's available on the DHS website. But if they're not disabled and you don't need waiver services, if they're not certified as disabled, they're not getting Medicare, you can apply through MNsure. Their basis will not be a disability basis through MNsure. It would be as a single adult, if that's their status.
Okay, one more question and then I won't take over.
Okay.
What if you have an adult who is currently who has Down syndrome, so they have a disability, they are in the process of applying for SSI, and they also want to apply for MA. This is all happening at the same time. So they currently do not have a disability certification. How do they apply for MA in Washington County?
Yeah, if they do not have a certification of disability yet, sometimes, you know, I'm sure you all know, that can take a very long time.
Mm-hmm.
You know, applying through MNsure is the quickest way to get medical assistance coverage. As long as they're not Medicare eligible and they're not an SSI recipient, you certainly can use MNsure. But once they become Medicare eligible or an SSI recipient, they do have to then, it's a different system for us, but their eligibility type will change. So if they're not certified disabled, again, not getting SSI, not eligible for Medicare or not receiving Medicare benefits, their eligibility basis will be as a single adult, assuming they're over the age of 18 and they don't have any children. So in that case, you can apply through MNsure, depending on how long the process, but as soon as they get SSI eligible, they do need to be moved in, and we can work with you on that. So what you would do is you would just call and report, hey, this person just got approved for SSI, we will let you know what needs to be done in order to make that transition. It's a fairly simple one. SSI, they've already done an asset test, so that's a fairly simple process. So if you just need to get MA as soon as possible, you can certainly use MNsure to apply.
So not the long-term care services application.
No, not if they're not already considered to be disabled.
Okay.
And when we say disabled, for us, that means basically it's one of three ways: either certified disabled by the state medical review team, already receiving Social Security benefits, Social Security has already determined them disabled, or if they're on the DD waiver, then the social workers can determine somebody as disabled. Those are, so even if somebody considers somebody disabled, those are our criteria in order for us to consider them to be disabled.
Yeah, because on the website, it's like the long-term care services was an option for application, and the wording of it is if you are an adult who is disabled, like this is your option.
Yeah. And again, unless they're already where we would consider them disabled under those three circumstances,
Okay.
they're not disabled until one of those entities says they are.
Okay, perfect. Thank you.
That's-
Thank you for
you're welcome.
answering.
Okay, if there are more questions, you can put them in the chat. We'll get back to them. We can move on to Jenny with cost-effective health insurance.
Okay, so once you've gotten through the application process and you've been determined eligible for medical assistance, everybody on medical assistance needs to be enrolled in a managed care plan unless they meet an exclusion reason. And for this population, usually those two main ones are disability exclusion or if they have other health insurance. Cost-effective insurance is a separate determination. It doesn't, you know, it's not an automatic thing if somebody's on medical assistance that their other insurance is found to be cost-effective. It's a mathematical calculation. We plug in the numbers, and if it's over a certain amount, then it's cost-effective, or under a certain amount, it's considered to be cost-effective. If it's not, it's not. And I could show you if you wanted. We have a flow chart in order for us to determine where we are looking as far as eligibility for, you know, there's a flow chart that we start with. If somebody has other insurance available to them, we look at how many people are open on medical assistance, what is the cost of the insurance, sometimes we need to look at if there's only one person that's medical assistance eligible, we need to look at what specifically is the cost for that person to be on or being covered by the employer-sponsored insurance. Because really what the state is looking at is, rather than enrolling somebody in managed care, and the state pays a premium every month, just like an employer would to keep somebody on insurance, is it less expensive for the state to reimburse somebody to have the employer-sponsored insurance be the primary and medical assistance be a secondary insurance? Reimbursement for cost-effective insurance cannot begin until a determination is made. So we cannot make that determination without all of the paperwork, and that usually involves all of the costs that are involved that the employer offers, all the different health plans. A lot of times for us here at Washington County, we have 4 different plans to choose from. And then of those 4 plans, you can pick employee only, employee plus spouse, employee plus children, or family. So that's pretty common these days as far as how that is all laid out. So that's really 16 different choices. We need the cost for all of those plans in order to make a good determination. And all changes need to be reported in 10 days. Another place where people kind of fall off with cost-effective insurance is most people's insurance plans, the premiums go up every year. The majority of that happens for January. As soon as people know what the rates change is going to be, they should send that in so that we can make a new determination going forward. Because if we don't have that information, we can't determine cost effective, you will not get reimbursed for that insurance. So questions about cost effective insurance?
There isn't any questions on the cost effective. Oh, there is one, I guess. I'm sorry, I'm reading it as well. Someone had received notice that their primary insurance is cost effective and the reimbursement determined will be $34 for each proof of premium payment.
So
Mhm.
I'm reading the question as you're reading it too.
Yeah.
The estimate seems low. It does seem low, but my guess is that is for a portion. So sometimes we have to prorate it. Initially, we look at, again, it's a flow chart, so it can be different depending on the situation. That looks like it might be a prorated amount for the reimbursement. It seems high if we're just talking about dental, because we do look at health insurance first. So what is the cost of the health insurance? If that health insurance is below that threshold, then we look at dental, and then we also can add vision. I feel like there's a fourth one now that we're starting to see pop up. So that could just be the prorated amount for the only person that's open on MA. That's their share of whatever your monthly premium is. But if you have questions about the determination, you can certainly call and we can explain that.
It looks like there's two people looking for who to contact for health insurance reimbursement. Is it one of these numbers here?
So if they should call 651-430-6459.
Would you mind repeating that and I'll write it in the chat?
651
Okay.
430
Uh-huh.
6459.
Okay. I did notice a few other comments and questions regarding grant waivers, PCA waivers. I feel like that's something that you guys will be addressing in one of the upcoming slides. But one that maybe does apply to these is there's somebody that is on medical assistance and but non-disability. If they also would like to get MA with disability, do they have to start that process all over again?
So my question would be in this scenario is exactly because, again, this is a situation where we can look at a couple different things. Is the need that they want straight medical assistance without the managed care enrollment, or do they really need the disability status? Because if the child, let's say, is in MNsure and they have medical assistance and they have standard medical assistance with a managed care enrollment, but they are needing a managed care exclusion, so they're on just straight MA, which we'll see a lot with clients needing PCA services. Then at that point, we would need an exclusion reason, which would be through Social Security, SMRT, getting a certified disability to exclude. If that is not an option right off the bat, or if we're looking at pursuing a waiver, then I would assume that they would need to reapply for an assessment for waiver with social services. But that's as far as that piece goes, I'm assuming that part. But excuse me, it will kind of depend on what kind of scenario we're looking at. If we are just looking at a managed care enrollment exclusion, or do we really need the medical assistance disability determination?
I'm the person that asked the question, and I have a 13-year-old who has a plan through our employer, and MA is secondary. And when she was younger, I feel like we qualified for TEFRA, but I I may have that information not fully, I may not be remembering because we do not have Tefra now. The main thing I'm running into is now that she's 13, I don't have access to her chart or lab results and things like that. And she has a cognitive disability and a chromosomal disorder. So it's an ongoing thing, and we've had her evaluated by Fraser, and I'm sure more evaluation would be needed just to have a status through SMRT, as it sounds like. So I'm not worried about maybe going through that process, but I feel like it would be beneficial to have that disability kind of waiver attached with her MA. And maybe I, correct me if I have the information wrong there.
Well, I think we talked about this earlier. It's that turning 13 and being able to inquire about test results and such. Jenny, you had a little bit more on that than I do.
So I have a 13-year-old daughter, so I think it did have to do with a COVID result. I was trying to find out what her results of her COVID test was online, and it said something like, I don't have access to that. I was surprised. I think you have to work with the insurance company. I don't know that us certifying her as disabled would actually get you that information. I'm not sure exactly what the process is, if they would ask a 13-year-old and make them sign off on something, or if the child is unable to do that, what process they would go through. So I would work with your insurance company on that to find out how you can make sure you have access to all of the medical records that you need.
Would it be insurance or the health, like the clinic? Because, for instance, the test results will come through the clinic, and I think it must be a state mandated 13-year-old. But if she's vulnerable already, if we ask her to sign the rights over, that seems not appropriate. She'd be vulnerable to go along with something that someone asked her to do. So I feel like it almost has to be verified that she probably doesn't have the cognitive ability to sign her rights over. But I can ask her. I don't think she would refuse, but I just wanted to make sure to do it the right way, because as she gets older, that would seem more appropriate, that because she'll have, we were deemed at Fraser that she'll have to have a guardian for the rest of her life.
Yeah, we did. I think you we got an email with some questions. This must be the one, but most of us hadn't heard about it except for the parents that have run into this. So it's not really a social service thing. I think it's a medical thing, but it seems like if she'd sign on, well, I don't even know if she can sign, but it seems like you should be able to get the clinic to share, or maybe you can share her diagnostic. I would check with the clinic or the insurance company, but it really isn't a legal guardian, like guardianship takes over at like 18. So it's not usually something we run into, except we were talking about it with the people that have kids at that age are running into that same thing.
Yeah, I would work with your insurance company, because that should be a blanket then permission for you to get her medical records, because your insurance company should have. I don't know if you check online. In my case, I was looking online to try to get the information that I needed, and there was something I needed to check. So it was through the insurance company, not necessarily the provider. Seems like it would be a lot more work if you go to each individual provider to try to get that permission.
Just as a comment on the sidebar, it looks like there is a parent who was going to Gillette, and they said to do that through them. So that was one place where you did have to go to the provider, but it does seem like it'd be easier if you could just do it through the insurance and get that overall designation. I think that's it for the questions for now. As we get into the grant and waiver, there might be some more questions.
So I just had another in there. They wanted to know how they know it's accurate. Any paperwork that eligibility workers send out should have a phone number. My team, my team works as a team, so there's not necessarily an individual name, but there will be a contact, and anybody who answers that phone should be able to answer your questions. If you have a medical assistance case with TEFRA or a waiver, you probably get an individual caseworker, and you should have their name and phone number available to you.
Okay, if we still have more questions, feel free to keep adding them to the chat. We will kind of come back to them. Now I will open it up to Jane, who is going to give you an idea of the more IDD specific services, because for IDD as well, you have some eligibility criteria and other things to consider. And this is not specific just for the waiver. There are other programs that are not considered waiver programs. So Jane is going to get us started with that conversation. You're still muted, Jane.
Sorry, can you hear me now? I always have trouble with that, and I apologize. So again, I'm Jane Feller, an IDD intake worker here at Washington County. And basically, if anyone's ever interested, any from old to young or young to old, although it is probably easier to apply for IDD services when you're under the age of 22, because after the age of 22, you have to do some digging on how a person may have functioned before the age of 22. So just remember the things that we are saying today is related to Minnesota state statute and 9525 something, but it's related to Rule 185 case management for intellectual and developmental disabilities in the state of Minnesota. So we're just one of the counties that follow the Minnesota state statute for IDD case management. And so basically, everybody needs to have a min choices assessment. Let me just say that ahead of time, because anyone that is looking for any type of service as related to a possible special need will need to have a Minnesota choice assessment. And that includes applying for IDD case management. And so that number is 651-430-6484. I think we have it somewhere. That is for Washington County, if you live in Washington County. So, can you go back to the first one, June? Or, okay, so I got off track a little bit. So when we look at it, it's Minnesota state statute, children under the age of 5. We still need to see a cognitive developmental score. Sometimes you can get that at Children's Minnesota or your school district, team, or Fraser, but we need to see a cognitive score. It's not necessarily an IQ, but a cognitive score and what we call an adaptive behavior composite score. Age 5 and above, we are looking if at all possible for an full scale IQ score. It's 70 or below that's eligible. And if it's above 70, it gets a little bit complicated. Let's just say that your adaptive composite still has to be significantly below average, even if you have a relating condition. And related conditions could be like autism, cerebral palsy, epilepsy, fetal alcohol, and I imagine I'm missing something, but anything that may be related to neurodevelopmental needs, but it cannot be a mental health diagnosis. It can never be a related condition when you have an IQ above 70, can never be like ADHD or schizophrenia. It can never be a mental health diagnosis. It has to be related to neurodevelopmental condition. And so that's the testing that we're going to look for when you apply for IDD case management. So now you can move on if you want to. Okay, so yes. So when you have the level of intellectual developmental disability, the IQ is 70 or below, and it starts at mild and then maybe around 50 at moderate. And I won't keep going, but That's based on the National Science Foundation. So we do look at that. And then a lot of times the psychologists in their summary will say, this is mild intellectual disability, or this is moderate. So yes, we need a formal assessment. A lot of times people send us the school evaluation reports, or for little ones from birth to 3, the IFSP, and sometimes that is all we need. But when the scores are not there or the scores are too high, we want to see if there's a related condition, and maybe that'll work as eligibility if the adaptive behavior composite is significantly below average. But yes, normally typically we want a school psychologist or a neuropsychologist. We are looking more at Children's Minnesota of someone who is trained to know how to do cognitive testing for the little ones under the age of 5. We could go with a doctor or someone that's trained to do adaptive testing and cognitive testing. We will accept that. But we won't accept just a regular MD, a family physician. They have to be trained, and Children's Minnesota does have some in how to administer IQ, cognitive, and adaptive testing. Okay, so I think I touched on the related condition. So let's say your IQ is above 70, but you still feel you or a family member may be eligible. So some of them I said was autism, cerebral palsy, and epilepsy, and fetal alcohol. And again, it can't be a mental illness, so to speak. Has to be happen before the age of 22. And if that can't be determined, we do a lot of digging and we look at social history. We try, but it's so much easier to apply before the age of 22 because you have to show in the state statute that you showed these delays before the age of 22. So if the family or friend is, keep their school evaluation reports, even if they seem old, because we want to know how they functioned. And this is likely to continue indefinitely. And resistance, this is where this is substantial functioning ability under adaptive composite testing would show. You get a composite and you look at the areas of self-care and language and learning, mobility and self-direction and independent living. And you put a composite together, and that has to be, technically it's supposed to be 70 or below. There are some exceptions, but I'm not going to go through that because some of the tests will say clinically significant instead of 70 or below, but I'm not going to get into that today. But we are a team that is trained to look at these evaluations. It's not just me, there's at least 3 of us. So you need a formal complete with, if possible, complete it with 12 months of application date. It doesn't have to be, but we don't like real old ones. But once you're diagnosed with for autism, for example, we'll take an older one because generally people are not undiagnosed with autism. So yes, here's the talk about the adaptive, has to be significantly below average. Yes, if under the age of 5, if there's a diagnosis of global developmental delays, the child may be eligible, but we still have to see testing. You can't have a psychologist say global developmental delays. We have to see cognitive and adaptive testing. And so, yes, you have to. So if you have a related condition, your IQ is above 70, you have to function similar to a child that does have intellectual and developmental disabilities in those areas of self-care and communication and so forth. So that's what I said. Prior to the person's 22nd birthday. And again, we have to do a little history. If the person is like 40 years old, it gets a little tricky, but we try. So we need the psychologists to do a social history if they're an older adult. And so they may have to be tested if they can't give us anything. It does get tricky. Again, if anyone ever wants to apply, it's so much easier to do it before the age of 22. So now, in other words, if somebody has a stroke at age 40 and they've had no other condition neurodevelopmentally until they had a stroke at age 40, they will not be eligible for developmental disabilities. So that's a very good point. And even when I started in developmental disabilities case management, that's how I started. it took me a while to figure this out. You'll see autism on a lot of school evaluations, but the Minnesota State statute does not take that as an autism diagnosis. It has to come outside of the school. The school has a different educational criteria to beat autism. It needs to be done on an outside agency for us to take the diagnosis of autism. We call it a medical diagnosis of autism. So like Fraser's or Nystrom's or Canvas Health, just because the school says autism and there's no other autism evaluation that was done, then we will not take that as a related condition. It has to come out from outside of the school. Yes, and yes, so again, 430-6484. Yes, let them know you're applying for IDD services. There'll be a packet you need to fill out, or you can go online, go under Community Services, Washington County Community Services, go online and say apply for IDD, and it's also online. But we still mail out packets, that's for sure. And yeah, so mail to you to redo, yeah. So you're going to need a Min Choices assessment. It will take a while to get that, but in the meantime, please work on your packet and return it, and to call me if you have any questions. Is my number on here somewhere? 430-8350, 651-430-8350. And let's see. Yes, and if you're not eligible for IDD, I will let you know. I'm the one that does. And then you get a packet of other possible resources, and also your right to appeal. Yes, so. And there we go. And when you call me, you'll get a voicemail that says, call this number. And the reason that is because we're just like many people, I'm like in the office once a week now. So the best way to reach me is my cell phone. And that will be, let me just say for today, that'll be, if you call 8350, you'll get two numbers. You can call that one. And then on the voicemail, it'll say, you can also call my cell number. Okay, and this is just some ideas for diagnostic testing for cognitive, IQ, and adaptive testing. Again, cognitive is more related to children under 5 because it's not really feasible to get an IQ test when they're 3 or something. But after that, we do look for full scales between ages 5 to 7. Yes, Washington County does not pay for this evaluation. So if you say I have no evaluations, I have no school, I have nothing, you're going to have to get IQ and adaptive testing, and your private insurance will have to be checked to see if they do pay for psychological or psychomotor testing that we require. And so a lot of times these agencies, and there's so many more, I'm just giving you an example. They will help you. They will want to know who your insurance is, and they will help find out if your insurance will pay for IQ and adaptive behavior testing for applying for IDD case management.
There are a few questions in chat. One has to do with the IDD case management process versus the SMRT. It seems like there's two different processes involved.
Yeah, the SMRT is so much different. Let me just tell you my part. To apply for IDD case management is all that it is, really. It's not going to be much, it's not going to be involved anything else. SMRT is totally different. So if you get an IDD case manager, it doesn't mean you're certified disabled, and it doesn't mean you're going to get a waiver for sure. You have to have a waiver need, but it gets you in the door. But the SMRT process is, that's related to medical assistance for special populations. You don't even have to be on MA to get a case manager.
Okay. Let's see, once everything is completed, how long does it generally take to be approved for an IDD waiver? And this might be coming up.
I would, yeah, I mean, generally it doesn't mean just because you get a case manager doesn't mean you'll get a waiver. It depends on your need and if other services can meet your needs, but we'll go through, the waiver is kind of the service or the payment of last resort if there's other options that can meet your child's needs. But if you got a case manager though, and there was really a waiver need, like you have an adult who's 18 and they need to move out into an apartment or a group home or whatever, it's still going to be a couple months for that whole process to happen. But I think we'll get in detail a little bit more as we get to the waiver information. Oh, IDD case manager, waiver case manager, it's the same. We're a case manager in intellectual disabilities, and we also have kids on the waiver. So basically it's the same thing.
Looks like that's it for now. Then the pending questions on waivers and such that it sounds like we'll be getting to next.
We will move on to the case management team. And since there was already a question about what does it mean to have a case manager? What do case managers do? I'm gonna ask Lisa to kind of just say briefly who case managers are, what we do, what to expect when they get a case manager, whether it's required or not. And then after that, we'll open up for Chantel to start walking us through some of the programs.
I have to find my mute button. So once you've been determined eligible, Jane actually assigns a case manager from one of our teams to be your child's case manager. And then we would meet with you, explain all the services that are available and what your child might need, get to know your child, see what maybe their service needs are. And then we would help basically case managers coordinate services. So we would determine what your child's needs are and what you think you need and what they need. And we would help you navigate the system and help you get services that will help your child now and through adulthood. So the services you may get as a child or your child gets as a kid may not be a lot. If they're not needing much, maybe they get a little PCA or home care services, or maybe they get a grant. But when children start to get to be 18, turning into adulthood, maybe that's a lot of times that's when we may authorize a lot more services. Like they may need a job coach, they may want to move out to their own apartment, need staff, they may move to a corporate group home or foster home. They may live with you as an adult, that's fine, but maybe they want staff to come pick them up and take them out to do fun things. So basically the case manager, we funnel the money, the payment, medical assistance payments we basically funnel the money to pay for those services. So most of the money is medical assistance, so it's federal, state money, and the counties are the keepers of that money, and we help authorize the service. So that's a little basic.
Thanks, Lisa. I think that's very helpful. So as Lisa said, the waiver is actually the very last option for services. It's considered the payment of last resort. So we're going to walk you through some of the other options available for services. A couple of them are available. And I hope this will start making sense for why we started talking about medical assistance. Some of these programs will require medical assistance, some will not, and we'll let you know as we go along. So I'll have Chantel, my colleague, get us started talking about the PCA program. I know a lot of people use PCA to refer to all the services that they get, but this is a very specific program, and Chantel will get us started.
Hi, everybody. My name is Chantel again. I'm a social worker in the IDD unit. I'll be talking about personal care assistance, or PCA. I'm going to pull up my little cheat sheet that I wrote here so I don't miss anything. But PCA is also known as an MA home care service. It's something that someone is determined eligible for based on a min choices assessment. So kind of like piggybacks off of what Jane was talking about. The personal care assistance program helps people with common daily activities so that they can be more independent in their homes and communities. Most PCA services are at home, but they can also help people wherever their daily activities take them, like the supermarket, at work, or at the library. The PCA may also help with other things like meal prep, shopping, paying bills, reminders, and travel with the person to medical appointments or community events. PCA services are a flexible, consumer-driven model of service that require medical assistance and must be medically necessary as determined by an annual PCA eligibility assessment or a min choices assessment to determine the number of hours a day. And typically what they look at for that is dependencies in areas of personal assistance, areas of need, and home management areas of need. PCA does not always require a case manager unless PCA is accessed through a waiver program. PCA requires a designation of a responsible party who cannot also be a paid PCA. So for example, a child right now with the federal emergency, parents can be paid as a PCA or a paid parent of a minor through the federal emergency or until that's done. But the parent can't also be the responsible party, if I'm saying that right. PCA also requires qualified professional supervision services to oversee plan of care. PCA workers can be hired from a private agency or an agency that you choose, and you can hire your own staff, which is called PCA choice. And I think that moves into the consumer support grant.
I was just going to say that if you're a parent of a minor and you're the PCA, like your spouse could be the managing party. And basically all they do is sign off on the paperwork and your time cards, I think. So you just can't be the same. You can't sign off on your own time cards and your own paperwork. So that's kind of how it works. And it's hopefully will go through the end of June is what we're thinking for the PCAs of minors to get paid.
There's a typo in the first bullet, so Lisa, I'm sure you'll catch that and clarify, please.
What did you say?
The first statement is not completely accurate.
Oh, yes, right. It's not.
I think I mixed up, I think, with the FSG, but
yeah, the consumer support grant is a program that if you're qualified for PCA, you can choose a consumer support grant instead of PCA. And what happens is the state has a grid. So based on your PCA hours that converts into a monthly grant amount. So you might get $900 a month. And before the COVID and the federal emergency where parents couldn't get paid to care for their own kids on PCA, this was a program where parents of minors could be paid to care for their own children. So we have a lot of families that signed up because they didn't want PCAs or they couldn't find PCAs and they were home anyway. So they chose the consumer support grant and would then be the paid caregiver. For the consumer support grant, the federal government does not let parents of minors or did not let them be paid as a caregiver. So it's only the state portion of the funding that you would qualify for under PCA. So it's generally about half the amount of hours that you would get under PCA. So, but under this program, you do have to be on medical assistance. You don't have to have a case manager. You don't have to be eligible for IDD. You just have to have a disability or be eligible for PCA. But under this program, you can also purchase goods and services. So you could purchase swim therapy, horse therapy. You could purchase sensory items for your child if they had sensory issues. So it's a program where it can be staff and goods and services and therapies. And basically you come up with a budget, find a company to bill medical assistance and hire you and run the program, and the county approves the budget and approves all the items that you're wanting to purchase. And then you have to have a reassessment every year, a MnChoice's reassessment every year, and then you'll get your new budget every year. So, did I miss anything? I don't think so. Oh, and CSG generally is taxable income for a parent, but we always tell you we don't give tax information. You can talk to your tax person, but generally, from what we know, it's taxable income.
Okay, we'll move on to Chantel to walk us through another program called the Family Support Grant. You're muted, Chantel.
Thanks. So Family Support Grant, or FSG, is a cash grant to families of children under 25 years of age with a certified disability residing at home. The goal of the program is to prevent or delay the out-of-home placement of children and promote family health and social well-being by enabling access to family-centered services and supports. Recipients between the ages of 14 to 25 are able to use the grant funds towards transitional services and supports to achieve an employment goal. When the recipient is working towards an employment goal, they do not need to reside in the guardian parent's home to utilize grant funds, but guardian parent will be responsible for monitoring grant fund usage and follow program guidelines. The cash grants are $259 a month, and sometimes there's exceptions that can be made, and hardship grants or lump sums can be considered. FSG requires disability certification or certification through the state medical review team, or to be determined eligible for Rule 185 case management or have a DD case manager. There's an income requirement of $111,102 or less. There's reporting requirements. I think they're usually quarterly, and those need to be sent to our FSG coordinator or case manager. FSG does not require you to be active on MA program, or requires you to not be active on MA programs such as PCA, CSG, or MA waiver programs. Spending must be directly related to the disability and beyond typical parental costs for a child of a similar age. The grant must be spent on services and items directly related to caring for the child with a disability. Only expenses that are beyond typical parental costs of caring for a child of a similar age may be covered and must be approved prior by the lead agency as a part of the child support plan. Some examples of expense categories include like home modification, adaptive equipment, assistive technology, parental support or respite care, special clothing, etc. Family support grant can be used as a gap service prior to actively using one of those programs or stop services under PCA or CSG for 30 days to obtain grant funds to make a lump sum purchase. FSG can be used for more than one eligible child in the home. And it can be authorized without an annual reassessment. And that kind of just goes into MnChoice's assessments are not required for all applicants of FSG. And I think there's some info on the slide about how to inquire or apply. There's a number, and then there's also an email link as well.
Thank you, Chantel. So PCA, CSG, FSG are three of the kind of basic level programs that we try to look at when someone comes to us in need of services and see whether any of these services will meet their needs. If it doesn't meet their needs, then we move on to ask the question of whether they have a need for the waiver. And Lisa is going to walk us through what the waiver is and How does one qualify for the waiver? Lisa, you're muted.
Oh, sorry. So the developmental disabilities waiver is for people that require a high level of care. This says ICFDD or intermittent care facility. It just basically needs, someone needs to have a 24-hour plan of care. So they're not going to be someone that's probably going to live in their own apartment and only needs a couple hours of service a week. Though those people probably wouldn't qualify for the waiver. It would be people that are kids and adults that are going to need a higher level of care. And it doesn't mean they need staff 24 hours a day, but they would need a plan. They would need a support plan for 24 hours a day. So, and a waiver need is, yes, the waiver, the state says they give us a waiver budget for Washington County to manage. And they say the waiver is the payment of last resort. So we always try to find other services that can meet your child's needs, adults' needs. But if that's not possible, then we would move to the waiver. So if PCA, like if you have a child that's 4 or 5 and they get 3 or 4 hours of PCA a day, and basically they just need help with bathing, dressing, you know, stuff that's not quite age appropriate. They have some behaviors, but you can hire a PCA to care for your child and that meets their needs, then we wouldn't be able to put you on a waiver. If you have a child that's 14, 15, and they're starting to have a lot of support needs and maybe going through puberty and having some behaviors, and you need a break and you need some respite and you might need some behavior support or extra staffing, then that probably would be a need for the waiver, because PCA, maybe they get 3 or 4 hours a day, but you need all kinds of other things like therapies that aren't covered by MA, or we have behavior analysts that can come out and support you. We have respite providers. You maybe need a fence in the backyard. We can pay for mods. That might be a reason that we would say, yep, this child needs a waiver, because their needs aren't being covered by just a home care service. We can put kids on the waiver, like if you're on PCA and it's meeting their needs, except they're in a wheelchair and they have some, they're getting bigger and you can't get them in and out of the bathtub, and the waiver can pay for roll-in showers or home mods. We can pay for ramps. We can widen doorways. So sometimes we put kids on the waiver just to pay for that, maybe a $10,000 bathroom remodel, and then you can go back to just being on PCA and that meets their needs. If your case manager, if you're talking to your case manager and you go through all the services and you're deciding that, this PCA is not going to meet my child's needs and we have these other service needs, then what happens is the case manager takes that request to a waiver team and they look at it and see what other services have been tried, and then they would review that and then give approval for the waiver. And then after that, then it would be finding service providers or MA billable providers to provide those services, whatever those might be, whether it's staffing or home mods or behavior support. And once kids get older and they become adults and they want to move out of the home, the waiver would pay for like job coaches, and they would pay for staff in an apartment. They'll pay for a group home if somebody needs that level of care. So as most of our adults are probably on the waiver once they get to that age and they want to be more independent. So yes, you do have to be open for medical assistance because that's how it's funded. And you have to have a social worker to get the waiver. We manage that budget. And there are a few different sorts of waivers. Like the traditional waiver would be staff in your family home, some community respite, assistive technology, caregiver training. We can pay for training for parents, like if you wanted to go to a training on autism, that can be paid for out of the waiver. We do adaptive equipment, a lot of like adaptive swings, weighted blankets, weighted vests, and we can pay for employment and day services when kids become adults. And then the other option is consumer directed support services, which a lot of parents use for kids that live at home. So under consumer directed support services, that's just a different waiver. I mean, it's the same waiver, it's just a different service. So that service, your screening, your MnChoices screening would give you a budget based on your child's needs. And in this program, parents of minors can be paid as caregivers for their child. And they can hire like grandma, grandpa, they can hire neighbors, they can hire whoever they want. And basically there'll be a company that would employ all of you and manage and be your employer. On this program, you can also purchase goods and services as long as it's recommended by a doctor. And that, I mean, a lot of our kids do equine therapy, swim therapy, and we do a lot of maybe some sensory stuff. There's all kinds of different therapies that you can purchase. It can't be anything that's covered by MA in general, like PT or OT. And then we do home mods. We can also pay for special diets. We have a lot of kids that are gluten-free or have a different special diet. There's like what do I want to say? There's a formula on how much we can pay based on the child. Like if a 12-year-old is $200 a month to feed, there's a percentage that we can pay. So CDCS is probably what most of you hear about, because a lot of parents want to direct their own care. They want to hire their own staff. They want to manage their services for their child. And they can get paid, or they can hire other people to get paid. But it's kind of just a flexible, person-centered, kid-centered service. Is there another one, or is that my last one?
No, that's the one. And then maybe we can open up for some of those waiver related questions. It sounded like quite a few of them will be related to the waiver and some of these programs.
There's some questions that just came up through this last session, so I'll start with those because I do think some of the older questions may have been addressed already. Let's see. Can you start on the CDCS if you prefer your own family to be that informal support staff, or is the CDCS a last resort?
No, if you're approved for the waiver based on your child's needs, you don't have to use traditional services first. We would, I mean, if you want to do that, and yes, your child needs more than just home care or whatever, you can start with CDCS. And most families just start with CDCS because they want to direct their own care and find their own caregivers.
Just as a follow-up to that, is they typically do people have to go try out the PCA step first and then go to CDCS, or is, can someone right when they're going in through the system be qualified for CDCS right off the bat?
It would be when you first get a case manager and you find out what your PCA hours are. I mean, if you had 2 hours a day, if your child is eligible for 2 hours a day, but you had all these really other needs like modifications to the home or behavior support needs or all kinds of therapies that they really need to be going to, PCA is not going to cover that. You don't have to start with PCA, but we would look at PCA first. If that meets your needs, we wouldn't be able to approve the waiver. But if we look at right when you come in, if you have an assessment, we look at your needs and you say, okay, this is what I get, but these are all the things I need, and that's not covered under PCA, you don't have to start with PCA. And if we know it's not going to work, we know it's not going to work.
Mhm.
But we have to look at that first. And there would have to be needs above and beyond what the PCA hours would cover.
Okay, thank you. There's another one here. The waiver that you had just referred to, someone wanted some clarification. Is that different than the one being certified through SMART? Or maybe if you can talk about how those are related or how that, what the process is.
No, SMART is being eligible for medical assistance. That's the way you get eligible for medical assistance if you're not, and you're disabled. The waiver is a service that's going to be paid through that medical assistance. So you get the waiver through MA SMART if you're SMARTed.
So couple of steps involved. So if you're not certified disabled first, but you're looking to be put on a waiver, you have to be certified by the state medical review team in order to qualify for certain waivers. Not the DD waiver, because the social workers can do that, but some of the other waivers you need to be certified as disabled for. CADI or CAC waivers, those you need to be certified disabled by the state medical review team or Social Security.
And those other waivers like CADI are more for adults, mental kind of folks or medical needs, and CAC is for kids and adults with who are medically fragile that are nursing hospital level of care. So it's just a different, it's called a different waiver, but.
See, we have another one here. Are IDD and DD waivers connected?
They're the same.
Thanks, Chantel. And then there was a question on TEFRA. I know we didn't really talk about TEFRA too much, but it says, if I'm a parent paid PCA, would I be billed back the hours plus the agency fee through TEFRA?
So I don't know that I could answer that question, but just to clarify, TEFRA is different than the waivers that Lisa is referring to. TEFRA is really, with the other waiver, you get additional services above and beyond what medical assistance will pay for. TEFRA does not. The reason for TEFRA is for those people who has a child with high level of needs, but is there over the income limit. So it's a way for people who have that need to get on medical assistance for it to be a secondary insurance, but their income would generally be considered too high.
Right, and so that parental fee that they're paying to the state is like their premium that they're paying the state each month to have that medical assistance. So if it's within the normal billing periods of what medical assistance covers, you wouldn't be paying more for it. If your parental fee is $400 a month and it's a covered service, you would just be paying that $400 a month. It wouldn't be more than that.
If I understand it correctly, TEFRA also, if you're only spending $300 a month, you would only be paying $300 a month. Isn't that correct?
They can reconcile it. It's done through, the state actually does that themselves. It's not something that we do at the county on that end of it. But you can go back and have it reconciled with them if there's a certain amount that if you're not meeting what your premium is. And again, it's not something that we do on our side, but it's done through the parental fee unit, I believe, is who it goes through. And then they will look at what you're paying, what your total bills are for the month, and you may pay $200 and your parental fee is $400, or you're using $200 worth of services versus the $400 worth of parental fee, and they can reconcile that. But that's not something, again, that we do or know about on our end.
So in a way, if that 200 represents your PC hours you're paying yourself plus the agency fee, you are kind of getting, you're kind of how would I say it? You are kind of paying into what you're getting paid back.
Yes, in that situation, if you're using less than what your parental fee is.
Mhm. Okay. Well, we have all kinds of questions. Let's see, if your child is generally healthy but has high IDD needs, does TEFRA make sense so you can get a CDCS?
If you're over the income limit for regular MA, TEFRA might be the only way you can get the waiver services, if I'm understanding that, because you have to have MA in order to get the waiver. But if your child is generally healthy, as you say, you probably wouldn't qualify for the waiver. And with TEFRA, I always say, look at what it is that you need. What is your, because most people, a lot of people that I've seen come in contact with have other health insurance because their income is high. Generally, they have other health insurance. Sometimes their regular health insurance through their employer covers most of what they need so that they don't need to apply for TEFRA to get anything additional. Does that answer that question?
I think so. I think to expand on it, I would say the CDCS is if you don't have the high medical needs where you need home modifications or other high cost type things, then you may not even qualify for CDCS, right? Because that's like a certain price. If it, if you're generally healthy, PCA may be the way to go.
You can, I mean, we have lots of kids with autism that are healthy medically, but they have really high maybe behavior needs and a lot of support needs and staffing needs. And maybe the family needs 8 hours a day of staff support to even help manage, keep them in the home, and just they're busy and they need a lot of support. Then, I mean, if you paid $600 in parental fee and you get 8 hours, 8 hours a day of support, you would still be getting a lot more. You'd be getting a lot of service in your home. So it kind of depends on what your needs are.
Mm-hmm.
And case managers can help you. I mean, it's kind of like we could come up with what we think you need first, and does this make sense? And how much support do you need? And then you could check on the parental fee and see if that would make sense for you. And then apply for medical assistance.
I would just say from my personal experience, what was originally thought was needed for my support hours changed quite a bit. So even though we are paying TEFRA the services, if I would have based everything on that first assessment of how many hours we would qualify for, I maybe wouldn't have continued through the process, but things were reevaluated. And then it did make sense to pay into TEFRA and then also get PCA support. It's that first brush isn't always the only one. It would get reevaluated later on. Let's see. There's a lot. So someone is asking, just to clarify, you get MA if needed, then you go for the waiver or a case manager to avoid duplicate steps.
You don't need medical assistance to have a case manager. We have lots of kids on our caseloads that their parents don't want medical assistance or pay a parental fee. They kind of just want a case manager there as a resource. We can go to school meetings. We meet with you a couple times a year. We can give you, I mean, if you're looking for like, hey, where's summer camp for my child with autism, or they're looking for just a little, maybe a little bit of respite. So you don't need to be on medical assistance to have a case manager. So you could have a case manager and then down the road decide medical assistance is what you need to get services.
Mm-hmm.
Be on the waiver though, you have to have medical assistance.
Yes, and a case manager, yes.
Just to add on to that question, so if you just want the case manager, that's the IDD evaluation. when you're applying?
That would be the Rule 185 case management, the DD case management.
Okay, got it.
And
Thank
you would
you.
have the min choice assessment and Jane would determine you eligible and then you would have a case.
Yeah. Thank you.
See, one more question. Oh,
I can answer the one about the alarm system for kids who get up in the middle of the night. The consumer support grant, I've seen that be covered under that. You know, kind of just depending on their budget. That is something that can be covered under a consumer directed community supports waiver as well. So.
And the family support grant, you could use your grant to cover alarms. Yeah, we pay for alarms a lot. Door alarms, window alarms.
Adaptive safety equipment. Yep, that's a big one. GPSs, door chimes, door alarms, home security.
see, any other questions? And feel free to speak to, you know, it doesn't all have to go through chat. It looks like we're tapering off here. Any other questions? One more in chat. Are waiver funds taxed? E.g. as parent pay?
Generally, no. Again, talk to your tax attorney, but through the waiver, when parents of minors get paid on CDCS through the waiver, there is a provision where that cannot be taxable income.
However, it is taxed under PCA, right?
Correct.
And
And
CSG.
Yeah.
And okay. Chantel has answered the last one.
Okay, so I see that we're already at 7:34. So if you could bear with me for a couple more minutes. I know there were some questions about guardianship and wanted to kind of walk you through a few points about that. And then if there are any other questions coming up, we can address those as well. So guardianship is one of those things that come up all the time because of concerns. Like right now, we were talking about someone who is 13 trying to get access to medical records so you can support them the way that you wish to do it. And the traditional route was someone is turning 18, we go to court, we apply, we get guardianship, and we move on. But things are changing, and we are having to make considerations for how best we can support people without being very restrictive. So we are trying to figure out different ways to make it work without necessarily having to go to the courts when someone turns the age of 18. So there are different pathways that we now like to discuss with families. And then after that, we would make recommendations and say, it's usually really important to contact someone who practices family law who can help you figure these out. So one option will be what is called supported decision-making agreement. This is just an agreement between the person who is disabled, who is turning 18 or over the age of 18, and a loved one or someone else that they trust. This person will be the one who supports them in making informed choices about their lives. So this can be a parent, it can be a close friend, it can be a sibling. There's a template that we're going to provide. It's embedded in the PowerPoint that gives you an idea of what that agreement could look like. So this becomes an agreement between you and the person you trust that can be contacted and can also be there in person or to contact your providers and help you make informed decisions about your life. The other option that we like to discuss is power of attorney, which is the document that will allow someone to appoint another person or an organization to help manage their property, or you can get a conservator who can manage your financials, or you can get a power of attorney for medical things as well. So a lawyer can help you tailor that power of attorney to make sure that it applies to the things that you want to address. So a power of attorney can be very adaptable. It can allow more or less support It can also be restricted in terms of time. So I can give you an example of how if I was to travel abroad and I have somebody that I take care of, I can give someone power of attorney, for example, for my children and say, for the period of 6 months that I'll be away, I'm giving you the power to make these decisions. And this can be revoked at any time. So it becomes a more of a flexible way to help someone make decisions about their lives without being very restrictive. But if you were to go the traditional way or the legal guardianship process, this is a process that requires you to go to court and petition the court to be appointed a guardian for someone. There are specific rights that are listed by the court, and you can pick and choose which ones you will be a guardian over and which rights become the rights of the person. So for example, if your loved one is able to vote or things like that, you can become a guardian, but they can retain that power to vote the way that they please. Guardianship is considered to be the most restrictive of all the different options that we have. So in Minnesota at the moment, when someone is applying for guardianship, they will ask you, and the language in the statute has changed to include considerations for less restrictive ways of addressing some of these needs. So you don't automatically just say, well, someone has turned 18, I want to do guardianship. They will want you to consider some of these other options. So if someone can make decisions in certain areas, then we could try things like, as I said, supportive decision-making, power of attorney. There are other things like a healthcare directive that says exactly what should happen in medical situations or medical emergencies. You can get a rep payee to help with finances and not necessarily have to go to court. And most of these will usually have less demand in terms of paperwork and reporting compared to what the court will require. And then you can have the time-limited guardianship. So it's time limited in the sense that it goes up to 6 years, and then you have to go through a review process and ask yourself, have things changed in the past 6 years? Can this person now become an independent or a free agent, as they call them in the legal terms? Can they now start making their own decisions? If not, then you petition the court again in order to continue that guardianship. So there are options beyond just going to court and becoming a guardian. So those areas that I mentioned, that when you are applying for guardianship, you'll have to think about determining where a person is going to live, the care and comfort of that person, the maintenance of their needs, the reasonable care for the person, medical and other professional care that may be needed, entering into contracts, supervisory authority, and other things that may be involved in terms of making informed decisions about somebody's life. And then, the court process itself, it can be long, it can be very involved. And the best recommendation we can make is to say, please contact an attorney. There are quite a few resources and organizations out there in Minnesota, especially, that are advocating for people with disabilities. The ARC of Minnesota, and what was the other one? Chantel, you remember? Lisa?
The Volunteers of America.
The Volunteers of America.
Fantastic training.
Say that again?
They really have a fantastic training through Volunteers of America. That's something that all of us case managers did at the county. And I think LifeWorks is one that they're starting. LifeWorks, which is a fiscal management service provider, I think they're offering training now. And they also have like advocates at Volunteers of America. I think even Pacer, ARC.
And we've included some links, and we'll also send over a resource to Valley Friendship. They can share it with anyone who is interested, that can give you some leads. Again, there are so many providers out there. We do not in any way endorse anybody, but we can give you a starting point and say, hey, we've worked with some of these organizations, check them out. And the ARC, Volunteers of America, those are mostly advocacy groups that can help you figure out and make sense of what to do. And then there is also a group of lawyers throughout the state who are willing and can provide assistance with getting a guardianship process done, sometimes for free, depending on your income level and things like that. And when you get in touch with us in the case management team, we'll be happy to walk you through that and provide you resources. We may have some leads, maybe a list of some of the lawyers that we have heard are now accepting people or have been helping people. And we can get you started with a list to get you going in terms of looking for someone who can help you with that. But when it comes to paying for the legal costs associated with getting guardianship, the waiver does not get involved with that. That's a completely separate issue when it comes to services that we provide.
Lisa, what is that term called? Is it like to inform a pauperous, or what is it where if the individual who's needing the guardian, I forget, like I was trying to
Generally, the list of lawyers that ARC has are lawyers that will do it for court costs, because when your loved one turns 18, they probably are considered indigent and don't have a lot of money. So because they don't have a lot of money, they go to court on informa pauperis, and that means they don't have money. So usually the lawyers will do it for court costs. So there shouldn't be, I shouldn't say for, because it's not always exactly, but there usually isn't a fee to the parents. But we have a list of lawyers, you would have to check that out with them. We didn't know if we'd have enough to talk about. We kind of did.
Oh, you for sure. I bet we could do this again and you'd still have a lot more questions. This was just so informative. I know I've learned some new things and really, really appreciate everyone's time. I don't think there's any other questions right now. Anything new on the chat? Oh, one more, Emmy.
Hey guys, sorry, I'm just gonna ask. So I submitted this in the just a question that I had, and then I've asked like 100 more. So thank you, everybody. Okay, so we have applied and were approved for MA and TEFRA because I was gonna do a parent paid PCA, and then we worked it through and kind of realized that that's not really gonna meet our needs. So we're trying to, our caseworkers helping us hopefully get a waiver. My question is, in the meantime, do we have to notify all our medical providers that we have this MA as a secondary if I'm not even sure that we'll ultimately use it? Like, are we required to use it while we have it for our son?
I mean, if you're paying for it, I don't know why you wouldn't want to let them know that you have it, because it's a secondary insurance that should cover like deductibles and co-pays, that kind of thing.
So my plan was to pay it at the end when it was reconciled in the summertime, because I didn't want to pay in a whole lot of extra each month. I just was going to pay in what we use. So essentially it would probably just be like all of my co-pays being paid in at the end of the fiscal year, and at the end of June or July or whenever it is. So it's not going to be like basically what I think TEFRA will do for us at this point in time is just pick up our co-pays, and then we'll eventually pay TEFRA back for picking up our co-pays. So it's kind of like a wash at this point.
I think by law, the providers have to know there's a secondary insurance.
Okay.
Just because I work in insurance. I'm not a county worker, but I work in healthcare, and if there's a secondary policy, they have to know, and that would be mandated by the primary policy because it goes in that order.
Okay, so I need to make sure that I start notifying, like, physicians and specialty clinics and stuff like that, therapy.
Yeah, they would just scan 2 cards when you present, say, a card.
Okay, I just want to make sure I'm keeping everything on the up and up, so thank you for that.
It also would cover, like, if you have a family deductible, whatever the copays are that are covered by Tefra, the family copay would, for your regular insurance, any of those copays that are covered by Tefra would be considered part of your deductible.
Oh, so the amount that we would pay to Tefra would count as toward our deductible and max out of pocket ultimately
Right,
in our primary?
right.
Okay, thank you.
There's so much to to juggle, and everyone's situation is so different. Thank you so much, everyone. Thank you, parents who have been on the call. I think this is a great dialogue, and especially thank you to Washington County staff, Lisa, June, Jennifer, Cindy, Jane, Danielle, Chantel. Thank you so much. I know it took a lot of time putting this presentation together, but I also think it was so valuable for everyone.
Well, thanks for having us. And we'd love a copy of the recorded message too, or the recorded, because